Infusion Nursing Society India is established in 2010 with the sole purpose of achieving nursing competencies for infusion practices and ultimately getting the patient safety in order when infusions are being handled either at hospital setting or during home care. We've been seeing a lot of deviations in infusion practices in the country, and things are handled differently without a documented evidence-based procedure available. With that baseline challenge, we also carried out evaluation in a couple of hospitals to see how hospitals are carrying out infusion therapy, and found that there is no standardization in this practice across hospitals. Hence, we represented India at US and finally adopted the INS standards of practice, got it reviewed in the country through a peer committee, and have actually launched these standards in the country. We are also talking to nursing colleges. We have met the INC president regarding the standards inclusion or as a reference for the students. We are encouraging nurse leaders to adopt these standards in their hospitals, and many hospitals in cities, various cities, metros especially, have adopted these standards. INS has developed training modules which are baseline modules as well as advanced modules, and these are knowledge based as well as skill based. The knowledge based training would be done on a learning management system which is online, and once the candidate completes that, we plan to have a skill based training, and that can be done with the help of simulation arms which are available in the country. Hospitals are also setting up simulation arms now for this training, and we will wish to drive it across the country, the knowledge and the skill-based programs of INS. INS standards are evidence-based and have been also endorsed by the Ministry of Health and Family Welfare, and we are talking to many quality teams across, including NABH, so that we could actually include these standards for reference in NABH standards. We are also wanting hospitals to adopt these standards and train nurses. They could connect with INS India. We have set up city chapters, we have got management councils in various regions, so that if we are contacted by various hospitals, we'll make it simpler and easier for hospitals to adopt these standards, and we'll help them train the team. Our dream as INS India is every nurse in the country gets certified through a certification program, develops the required competencies, and hence is able to deliver safe infusions for patients in the country.